So this is a biggie here, this article as well, and it's pretty serious stuff. I don't want you to get emotional or anything like that, but just know what we're dealing with. And they found that it was 1.5 years or more of chronic pain actually shrunk the brain about a decade or two of aging. And so that's pretty huge. It affects the gray matter in the brain, and that's more of your cell bodies and the cell body of the nerve. So that comes down to that stimulation part. Remember the 3 things that your nerves need to be healthy: oxygen, good food, and stimulation. And if that chronic pain is coming in there and starting to reduce the stimulation of certain parts in the brain, guess what? It's not going to be as healthy. It's going to start to shrink a bit. Okay, now they found with anyone with peripheral neuropathy that there's an area in the brain that was inflamed. Just like if you sprained your ankle and you inflamed that area, same thing in different parts of the brain. So chronic pain can actually cause inflammation elsewhere. And this is why a lot of supplements and nutrition is such a good idea too, is it can calm down a lot of that inflammation. So the area in the brain right there with all the red and yellow, that's the area that I was just talking about, where all sensation goes in your body. So if that's inflamed, it could actually be making the pain that you're experiencing worse. So maybe you even have just something minor going on in elsewhere in the body, but it's being made a whole lot worse off of what's happening right there. Okay, so there's some cool research on what the firing of a certain nerve can do to the brain as well, and it's called the vagus nerve. And this is so good for a lot of different reasons. It controls your digestion, it controls your heart, it controls blood flow, and they even found in concussions that this nerve doesn't work as well either afterwards. So with a lot of chronic pain, we're in a fight or flight status, and our sympathetic nerve system is really overactive, and it reduces the firing of this vagus nerve here. I know that's pretty small, but they're showing different areas in the brain that light up like crazy when you start to stimulate that vagus nerve. So this stimulation is great for chronic pain. It's good for autoimmune conditions like rheumatoid arthritis and all that. Stimulating this nerve can help with seizures and epilepsy. It can help with depression. It can help with so many different things that they're finding this is almost like the miracle nerve.
How do they stimulate it?
Yeah, so we're going to go over that in just a second, and they found you can even stimulate it via different parts of the ear. So the tragus of the ear, kind of where some people pierce things these days, is where you put a little ear clip, and you can hook that up to some electrical stimulation, and it lights up those parts of the brain.
So the ear, as I understand it, it can connect with the different parts of the body the same way as your fingers and your toes.
Yeah.
Like you can stimulate by massaging different parts of your ear, and it can be effective. Exactly,
yeah, so she's asking, maybe you don't need electrical stimulation, you can just start to rub that area. Yeah, and they found that the best way to get the full effect is to use some of that electrical stimulation, but it's worth a shot. Anything with neurology is, you're dealing with probabilities. Nothing's ever guaranteed. You can even prescribe a medication. It has a probability of affecting certain parts of your nerves. It's not guaranteed though, and so you have to kind of think of that with really any treatment. That's why you can't do the same thing with each person, and different people need different types of treatments. And so I wouldn't do this type of stimulation with certain neurology cases as well, but others might respond better too. Yep. Other ways you can stimulate the vagus nerve: singing. So hopefully you all have good singing voices, and it's almost like a sprint for that vagus nerve. You can sing in the car, and that actually affects the palate and back of the throat, and that stimulates that nerve as well. And there's different types of things we're going to get into in a little bit that you can do too. Even the act of eating, swallowing actually stimulates that nerve too. Alright, so I just want to explain what we do with neuropathy as well when someone comes into our office. And so we have to sit down, do a history with them, and figure out how much pressure they had on these nerves, and for how long, and what other causes could be contributing to the neuropathy. And we do a really thorough physical exam, so we have to run people through balance, we have to run through eye movements and look at sensation and strength and reflexes. range of motion, look at the health of your joints and how they're moving back and forth. Everything's related in neuropathy, and it takes about an hour. It's a pretty long first visit, and then we go forward from there. And unfortunately, the normal physicals that we have with our family doctor, not saying it's their fault, they have a kind of a timeline they need to go through, but maybe they'll go through 1 or 2 reflexes. They'll ask you a few questions, say don't smoke, and then maybe take blood pressure, and then off we go. And so we basically need to look at other things with neuropathy too, because once again, it can start 3 to 5 years before we're even aware of anything going on. All right, and so I just want to talk about adjustments as well, and people think, what kind of impact would that have on my nerves? And it was a Nobel Prize winner that actually found in the 80s, he wasn't a chiropractor, he was a medical doctor, that found 90% of the information going up to your brain comes from the muscles and joints in your spine. Because we live in gravity, the brain constantly needs to know what's happening inside our bodies, as well as what's happening around us. And so, once again, no other chiropractor is going to explain it that way, but that's what we're doing when we're adjusting the spine and affecting the joints as well. And so when we cause joint motion, we do a lot of arm adjusting and leg adjusting and feet and hands. When we cause joint motion, that causes joint and muscle activation, and that causes brain activation as well. Okay, and with any neurological program in rehab, you need to consider 3 things, and that is having someone do something voluntarily. You need to have them doing something artificially, and that's where you add something to the body, whether it be vibration or different types of electrical stimulation or something like that. And then you basically need to have reflexes firing for that person too. And I'll talk about a few of those as well. These are just things that you can't control. So you need all 3. If you just have one part, it's not as effective. You need to use all 3. So kind of speaking of reflexes, we all have different types of patterns that are hardwired into us. So there's a picture of a Heisman Trophy there, and this is literally the pattern of how we walk, and it's how our muscles actually start to fire. So when I walk, I put my left arm forward and my right foot forward. Then I switch and I go right arm, left foot. And that's the normal pattern. And when that breaks down, problems happen with your nerves too. Now you have a difference in muscle tone in certain areas, and things are firing different as well. So I'll have someone march, and sometimes I'll see people doing same side arm and leg like this, and they're literally not moving their muscles the way they should, and that can put more pressure on your nerves over time. So we can do a lot of different things with adjusting the different parts of the body as well, and that affects how your muscles are reacting too. So one thing to consider with neuropathy is literally muscle patterns. If you have a really, really tight pec muscle here and you dig in there and it's really tight, chances are, because this is so tight, it's actually turning off the other side. And now you're more prone to different injuries that way too. And that's what we look at with neuropathy too. Any tennis elbow. People generally feel the pain right here, but guaranteed if I turn the arm over, this muscle's going to be crazy tight. And that's why they're getting all the pain on that side. And so you have to be a bit of a detective to figure out why there's pressure on those nerves too. Alright, and these are some things you can do at home. I do a lot of these with patients as well, and they can work really well if you're consistent with them. But basically what you're doing is an active nerve glide, and you're lengthening the nerve, and then you're doing something either with the hand or the foot that actually shortens it and then lengthens it again. And it's kind of tough to visualize there, but basically we're moving the nerve back and forth as you start to lengthen it and shorten it. And in that sciatic nerve case over here, the person laying on their back, what they're doing is every time they move their foot up and down, they're actually moving that nerve about 3 or 4 centimeters back and forth, that sciatic nerve. And they're breaking up a lot of scar tissue there and allowing it to basically glide freely. And this could be really effective. You can do all the treatments you want, but if that nerve's still stuck in place, then it's not going to be as effective. You can use heat and ice to help with neuropathy, and generally heat will increase the firing of a nerve. So remember we talked about stimulation, so heat will cause more stimulation in certain areas, and ice will decrease the stimulation. It's literally firing less. And there's a lot of myths with ice and all that, and the general rule is anytime you have pain, you have inflammation, and you need to use ice. And anytime you have stiffness or tightness, that's when you can use heat. So it can get a bit more complicated than that, but that's just the general rule. So anytime you have pain, guaranteed at that microscopic level, you're dumping a lot of inflammation around those nerves too. So you just mentioned how you can stimulate the vagus nerve as well, and that's a little picture of the ear clip right there, and you hook them up to some different types of electrical devices. And you actually don't really feel a whole lot with this. You have to kind of turn it up to where they can feel it, and then you slowly bring it back down right below that. And then I was talking about headphones and vibration, and you can actually start to alter all the information going into the body goes to that one spot. You want to provide different types of stimulation that can alter that pain signal as well. And what's happening here in this picture is he has basically two types of little sticks that he's using to stimulate the painful area, and then he's pairing that with a non-painful area on the other side. And both those stimulations are going to the brain, and then you add in a different type of stimulation, and that's kind of almost confusing the brain so you're not in as much pain. You can trick the brain to do a lot of different things, and we'll actually get into that in a second here with the mirror therapy and all that too. So the brain is very powerful, and if you kind of figure out how it works, you can literally trick it into doing something that you want. All right, now even some electrical stimulation can be very, very helpful. I don't use this with a lot of people, but maybe something with like a drop foot, for example, and different types of things that way. But we use galvanic stimulation, and that's the exact same current that your nerves use to talk to each other. It's direct current. And I just touched on that a little bit, mirror box therapy. You can use the brain to actually visually look at something and start to restructure and rewire itself. So in this case here, she has, her left arm is inside the box, so that's the problem arm, or the problem hand. And she's looking inside the mirror, and it actually looks like now when she's moving her other arm, that the left arm is moving fine. And you can do different types of treatments that way. You have to be careful with this a bit, and this won't work for everybody, but it can be very powerful too. Okay, so I keep talking about posture, and I just want you guys to try something with me right now. I want you to kind of slump forward in your chair, so shoulders go forward and kind of arch the back. And I want you to take a deep breath in. Okay, and exhale. Now, we're going to get into good posture. Shoulders back and down. You're going to sit up straight. Now take a really deep breath in. If you feel like you can take a deeper breath in. And this is one of the parts that we were talking about with nerve health is oxygen, is stimulation, and good food. You can literally take a deeper breath and get more oxygen into your body to help your nerves if your shoulders are back and you're in a better posture. So it's pretty powerful stuff. We keep talking about, our parents have been saying sit up straight for years, but they didn't actually know what they were saying is it can help out your nerves quite a bit too. Now even in this poor posture example right there, you can see his head is forward, and when you're like this, your spine, your spinal cord actually has to stretch further, and that puts more pressure on every other nerve in your body. And if you do this more and more, over time that's going to cause more and more damage. You might wake up one day saying, ooh, my back really hurts, or I've got some tingling now going down my leg. It could have been based off your posture. So the spinal cord can actually stretch about 25% as the head goes more forward. So therefore you have to push the chin back and make sure your shoulders are back and down. So it's kind of a double whammy. You can get more oxygen into your body, as well as it literally takes more pressure off your nerves based off what your head is doing. So another example of this is, I've done this with a few patients, is they're laying on their back on the table. I can put their head forward with our headpiece, and I can stroke the bottom of their foot, and in some cases, their toe is going to go up, and that's actually a sign of either spinal cord damage or even brain damage. Then what I do is I move the head back to where it should be, and then I stroke their foot again, and toe is fine. So you can kind of see it's night and day. What you're doing with the head can change what's happening with your nerves too. And then basically I have a little exercise here that you can actually do. It's called the doorway stretch. And this is where you can start to get out of this posture. If you've been on the computer all day, you can start to reverse the effects, and you put your hands on either side of the doorway and you start to lean forward. And this can help open up the entire torso, stretch out all these tight muscles. You can take a deeper breath, and that can help a lot of chronic pain too. So on that note, we're going to talk about more breathing actually. And we do a lot of breathing exercises in the office, and I can't stress it enough, oxygen is very important for a variety of reasons. And you can literally shove more oxygen into your body just by breathing deeper throughout the day. Setting little reminders for yourself. You breathe in for 2 seconds, you can breathe out for 3 seconds. So you breathe in for 2, breathe out for 3 or 4 seconds. You basically want to breathe out more than you breathe in. And what this can do is it can actually change the acid-base balance in your blood. So it actually can shift it to more of a basic environment in your blood, because you're getting rid of more carbon dioxide. And this is part of the reason why even as we get older, pneumonia can be more of an issue and things like that, because we're very, very shallow breathers, and so we're not getting oxygen to the deep parts of our lungs. So if we're just breathing shallowly, bacteria can actually grow in different parts there as well. Chances are theoretically less of getting pneumonia if you're starting to use your lungs to their fullest capacity. And so I basically have here, you can reduce any of the autonomic consequences, so your automatic processes in your body, and that's blood flow control. By breathing deeper, you can actually shrink different blood vessels and basically around different areas of your spine, and then you can open up the blood vessels in different areas of your hands and your feet. And so that's, if you have really cold hands and feet all the time, guaranteed blood flow is an issue, and breathing can actually help restore some of that too. And there's different reflexes that we can use to our advantage that we're all born with. So we've basically just been doing that first one. It's called the Herring-Brewer reflex, where you take a deep breath in, and you're firing all the nerves around the lungs that can actually lower your heart rate and your blood pressure. And if you do this more and more, that reflex will get stronger and stronger. Another reflex that you can use is called the oculocardiac reflex. And if you've ever seen someone that's really stressed, they're kind of, they're sitting there, they're rubbing their eyes like this. What they're subconsciously doing is actually stimulating nerves that control your heart rate and your blood pressure. Again, you have literally nerves that connect from your eyes that go down to what's called that vagus nerve that controls your heart rate and your blood pressure. So you can do that more often to actually help the blood flow as well, so help stimulate that vagus nerve again. So this is what I'm talking about with functional neurology, is there's lots of things you can do to help even basically improve the function of your nerves. And if you do this stuff more and more, you're going to find that you can actually change what's happening. So there's one more reflex, it's called a carotid massage, and sometimes if you have a lot of plaque around arteries and things like that, you don't want to do too much with the arteries around the neck, but just know there's a certain spot almost where the traps enter the neck that can cause a decrease in heart rate and blood pressure if you actually start to massage that area too, just on the right side. And meditation is a big one too, and they found that you can actually improve blood flow with meditation. It's really helpful for that frontal lobe I was talking about before. Remember, all that research was affecting the frontal lobe with chronic pain and neuropathy. So meditation is actually a great exercise to help almost center yourself for what's happening inside your body and improve blood flow that way too. So exercise. A lot of people think, yes, I need to exercise, but you got to know how important it actually is for managing even chronic pain, improving blood flow. It has so many basically beneficial consequences that even getting out there for just little walks here and there, if that's all you can do, that's the best thing that you want to do. So it's no coincidence that athletes actually have a higher pain tolerance. So this goes back to the stimulation of your nerves. They're out there exercising, whatever sport they're doing, and they're activating their joints and their muscles and their brain at a higher rate compared to someone else. Therefore, the brain can actually feel more types of pain and not be aware of it, not make you aware of it. So they have a higher pain tolerance. That's key. As well as if you're exercising, your insulin release, your blood sugar control is actually better as well. Lots of research on that. You can basically affect how stressed you are by exercising, and it's that fight or flight response that we do need, but a lot of people are constantly in that state. That can cause pressure, more pressure on the nerves that way too. So exercise can help decrease the stress that your body is actually under. And then what they found in a lot of research is walking is just as good as running. You don't need to be a marathon sprinter or anything. You just need to walk a little bit longer, but it carries the exact same benefits too. So I just want to go over a few things that you can start to do as well. It's called a short foot exercise. And this is where you can start to strengthen all the tiny stabilizing muscles in your feet, and this can help take some pressure off of the nerves in your feet as well. This can help bring blood to the area as well. Remember, nutrition and oxygen. And this works really well, so I do this with a lot of patients. So basically what you do, basically start, sorry it's a bit grainy on there, but the foot is nice and flat. And picture these are your feet here. And then basically what you do is you're trying to scrunch them up as small as possible. But what you're doing at the same time is you're pushing down on the floor, and then you're trying to basically contract every muscle in your foot. And you hold for 10 seconds, and then you relax. And you do that 10 more times. You can do this while you're sitting here, you can do this when you're driving. It's really beneficial if you stick with this too. So any neuropathy in the feet, you want to keep those nerves healthy, you can bring more blood flow to the area, and you can help basically how much stress they're under every time you take a step. Yeah.
Is that why pigeon toes are created? If you do this exercise, does that help?
Pigeon toes, that's more twisting of the bones in the leg actually, that you'd have to look at more of the hips and things like that. Yeah, but this can, regardless, help how much stress even the knees and the ankles are under too. Yeah.
So I've been doing this one for decades.
Yeah.
And I just want to say it's really hard at first. Like I remember when I first started trying to do it, it was like I couldn't even move those feet. So just keep at it, because eventually you may be able to get there.
For sure.
But it takes it's really a very mental exercise.
Yeah.
Because you have to focus so hard on your feet.
Exactly, and remember I said you have less nerves dedicated to the areas in your feet. Remember that weird wacky figure we were looking at? That's exactly it. It's going to take a bit of some time of doing this because it's that brain-body connection. Yeah.
Does it help with drop foot as well?
It can, yeah, and that's a little bit different, but if you're able to contract those muscles, for sure. Because you're basically firing those nerves that are going to go up to help control that drop foot over time as well. Yeah. All right, now there's lots of different myths out there and weird things you can do for core and this ab crunch machine, this roller, all that. But there's a PhD researcher on core that actually found you only need to do 3 things to have a very healthy, happy core. And it's crunches. So you don't even need to do the full sit-up of moving your head all the way up to your knees. Just raise the shoulders about 6 to 8 inches off the ground and then relax. And do that about 20 times if you can. And so that's very beneficial. Then the next exercise are these side bridges. You can see in the middle there. And if you can't go fully on your ankles or your feet, that is quite a stress on there, then go onto your knees like this picture here. And try to hold that on each side for about 30 seconds if you can. And do 3 sets of those. And then the last exercise, I'm not sure if anyone has seen this one before. I know it's kind of hidden by the storage stuff. Does anyone know what that exercise is called? There you go. Good job. Bird dog. It's like that hunting dog. And so you're on all 4s on the ground, so on your knees and your hands. And then you lift your opposite arms and legs, keep your head up, and you hold that for 10 seconds. And then you do the other side. Hold for 10 seconds. And you do 3 sets of that. It looks easier than it actually is. When you're actually doing it for 3 sets, you'll probably feel a pretty good burn. And that's a really good exercise for strengthening all of the tiny stabilizing muscles in your spine. And that's going to take more pressure off of those areas too, off those nerves. Now, core is hugely important because the stronger it is, the less you're going to have injuries to your joints, your shoulders, and your hips and your knees. And it's the first thing to contract in any motion. When I reach over to pick up this water bottle, my arm doesn't move first, it's actually my core. My core contracts and then I move my arm. You don't really even feel it, but you can actually help out your nerves quite a bit just by doing core exercise too. You can help your strength just by doing more core work.
And balance.
Yeah. You can actually, without even going to the gym and lifting weights like crazy, you can actually improve your bench press or any other exercise you want to improve just by doing more core work, and your arms will actually be stronger. Okay, this is fairly self-explanatory. It's called a sit to stand, but this is really beneficial as well. Once again, it activates the core, and your leg muscles are so big, and there's so much blood flow that is around the muscles that you can actually improve the blood flow quite a bit by doing this exercise. And you're sitting in a chair, you don't use your hands at all, and you stand up, and then you sit back down. So a lot of us actually are guilty of just pushing down and using our hands to help ourselves stand up. And so we do get a bit lazy over time. And you do about 25 to 35 of these 3 times a day. Do as many as you can, but this is really beneficial as well. This can help boost different hormones in the body too, and improve the blood flow to your nerves. Okay, and I keep talking about this, the 3 things that nerves need. Maybe I'm getting a bit annoying at this point, but it's oxygen, stimulation, and it's good food. And so, if you have one part in your body that, you know what, the function just isn't there, so you can't sense temperature very well. It's cold outside and you don't know why everyone else is mad. So basically you start to stress those nerves more often in that way. So you put your hand or your foot under cold water for a few minutes. You get the body trying to sense that information, and then you switch it and try to get it to sense warm water for a couple minutes. And you go back and forth, back and forth. You constantly challenge those nerves to start to increase their function. Remember I said your nerves can change, they just need a bit of a push sometimes with some stimulation, and that's going to bring blood flow to the area as well. So that really works with anything. If you can't sense certain things, maybe you're dropping keys more often and you just feel really clumsy with your hands or your feet, then you start to do more tactile things. You start to move your fingers one next to another. You start to have someone draw things in your hands and you try to picture what letter that is or what object they put in your hand. You need to constantly stress these nerves to get them to improve. Okay, and just want to go over briefly just a few things you can do for diet. And Dr. Bonnie Kaplan said last time, you eat for your brain, and it's so true. You can improve your nerve function, your neurological function by what you eat. And you can do that by eating less of certain things that can cause inflammation in your body, and that is basically meat, and that's lots of carbs that we have as well, and these over time can start to produce more and more of these inflammatory chemicals here. You need to reduce your intake of salt, and the more salt we have in our blood, the less quickly we're able to fire our nerves as well. So they actually have to fire more slowly. And this is a big fancy chart here. I know it's pretty small, but it matters what types of foods that you're eating, and that can actually affect the acid-base balance in your blood. Remember I talked about even breathing can affect that. So the more basic and more alkaline your blood is, the better off your nerves will work. And so eating foods that are more alkaline, more basic, is something that is a good thing too. So the more alkaline foods are over here, more basic, and it's almost common sense stuff. We know we need to eat green leafy vegetables and different types of fruit like watermelon and raspberries and all that too. And the things on the far right, more acidic stuff. That's all your candy and sugar, ice cream, more carbs and grains and things like that. Okay, and one thing I just want you to know is there's hope. You're never just your diagnosis for the rest of your life. If you can take one thing away from this, is your nerves can constantly change, your function can change as well. And you just need to stay consistent, try to stay positive, and that's why this group here is so amazing, as well as you're offering hope here, Sylvia. So there's a very exciting field called epigenetics, where they're finding that your environment plays a much bigger role in what's happening with your body than even your genes or anything else. So what you're born with isn't necessarily what is contributing to to how you're feeling. It's literally what you've been experiencing every day as well over the last few years. And then the 60-40 rule here is we're all born with the same 60% nerve pathways, so they're called canalized pathways. And the rest, the 40%, we can actually change and improve and change the function of through our environment and our experiences as well. So very, very important. That's why you can't do the same thing with each person with neuropathy. And that's what makes it more difficult. It's such a widespread problem because people have different types of makeups with their nerves compared to other people. And the same treatments won't have the same effects.